everyone, I'm Anastasia. Welcome you all to this new session of Fundamental of Nursing. So in this session, we are going to discuss in general about lifting and transferring. Here we will be discussing about what is the purpose, what is the criteria for lifting, as well as the general principles and the general instruction which we nurses must follow whenever we are lifting or transferring the patient from one place to the other. So now let us move on to the definition of lifting. Lifting is defined as a technique which is used to gently as well as safely move the client based on the scientific principle. So here in the hospital, whenever you encounter any client who is not able to move by himself or herself because of their disease condition, then we can lift them. So here, for example, when we need to move the client from the stretcher to the bed or even from the bed to the chair, if they are not able to do it by themselves, then we can help them by lifting them. That is why they said that this lifting is a technique which is used to safely as well as gently move the client. Whereas transferring is a technique which is used to move or to make something or somebody move from one place to the other. So here, whenever we are in the hospital, when there are some clients who need to be transferred from one ward to the other or from one hospital to the other, if they are not able to do it by themselves, then we can also help the client in transferring from one place to the other. That is by the use of wheelchair or even by the use of a stretcher. So what is the purpose of lifting and transferring? Here the first purpose is that it helps to promote the task efficiently. So here, in case if you encounter any client who is not able to perform his activities by himself, and if he or she needs to go for any diagnostic test, if he or she cannot do it by themselves, then by the help of using the stretcher or the wheelchair, we can move the client and also we can send them for these diagnostic tests, right? So by this method, we can promote the task efficiently, because even if they are not able to do it by themselves, then with the help of moving the client, we can still perform the task efficiently. The second is to avoid the patient from any unnecessary effort. So here, if he or she is not feeling well, if he or she is not having that necessary energy in order to move from one place to the other, then by helping them, it also avoid the patient from putting in any unnecessary effort. And the third is to prevent nurses from strain and back injuries. So here, as we have discussed in our previous session about body mechanics, if the nurse uses the proper body mechanics whenever they are performing any activities for the client, then it also helps to prevent any strain or back injuries. And the last is to promote the comfort of the patient. So these are the four purposes of why we help the client in moving or even in transferring if they do not have the necessary energy to do so. And next is the lifting criteria. So here, whenever you are lifting any objects, you must put these four criteria in mind. That is the position of the weight, the height of the object, the maximum weight, as well as the body position. So the first one is position of the weight, right? So here, the weight of the object to be lifted should be as close to the lifter as possible. By positioning the object in such a manner, it utilizes the lifting force of the nurse, because the object to be lifted here will be in the same place as the nurse. So here, whenever you have to lift any object, the first thing is that you should make sure you position that particular object in this manner. The second one is the height of the object. So here, the best height for lifting any object vertically is slightly above the level of the middle finger of the person, with the arms hanging at the side. And the third one is the maximum weight. So here, any object which you are carrying, you should make sure that it should not be more than 35% of your total body weight. And the last one is the body position. So here, these body position will differ depending on the different lifting tasks which you are supposed to perform. So these are the four lifting criteria which you must keep in mind. That is the position of the weight. So here you must make sure that you pull the object close to your body so that it will be easy for you to carry. The second is the height of the object. So here the best height for carrying an object vertically is at a level slightly above the middle finger of a person with the arms hanging in the side. And also here, any object which you are supposed to be carrying, you should make sure that it does not cross 35% of your total body weight. And as we have discussed about the positions, right, in our previous session, so here depending on the lifting task which you must perform, your body position must also change. Here you must also make sure that you always use your longest and the strongest muscles whenever you need to perform any activities, whenever you need to lift any object, and you should prevent using your back muscles because this can also cause strain or lower back injuries. And the next one is the general principles for lifters and moving. So here, whenever you are lifting any object or whenever you are moving any object from one place to the other, the first principle that you must follow is you must position yourself. So here, before you move or before you even lift any object, you should position yourself in such a manner that you will be able to maintain a proper body balance. So here, whenever you need to lift any object from the floor, instead of directly bending, what you can do is that you can flex your hips and your knees so that you will be able to lift the object without any problem. And the second one is to keep your back straight. So here, whenever you are lifting any object, you must make sure that you keep your back straight because by doing this, it helps to maintain an even pressure on the bones and the spinal column, which will ultimately reduce the chances of injury. So after you have positioned yourself, after you have keep your back straight, the third is you must lift with your leg muscles. So here, as I've been repeatedly saying, that whenever you lift any object, you must make use of the strongest and the longest muscle. Because by doing this, it helps to prevent any strain which can occur on the lower back muscles, as well as it also helps to lift more amount of weight. And the fourth is selecting a suitable grip. So here, by using a correct grip, it helps to minimize the strain on the lifter because here they will not have to make the muscles overwork in order to maintain their hold. So here, using a correct grips is very important whenever you are lifting any object. The fourth principle states that you must tuck your chin. So here, whenever you are lifting any object, the act of tucking the chin may reduce the need for the spinal muscles to contract. So because of this, there will be a less chance of the muscle strain which can occur on the lower back muscles. And the sixth is using rocking movement. So here, rocking an object builds a momentum which can also aid the lifting process. So here, whenever you're lifting any object, you must use the rocking movement if it is possible. You must also make sure that you hold the load or that particular object as close to you as possible because in this manner, it will help to prevent any unnecessary strain on the muscles of your arms as well as of your back. And the last principle is that we should not twist or bend. So here, whenever we are lifting any object, we should move our feet instead of our upper body because this can help to balance the load as well as to minimize the strain which will be occurring in our back and on the abdominal muscles. So these are the various principles that a lifter must follow whenever he or she is lifting any object. And moving on to the next, which is the general instructions. So here, whenever you are lifting any objects, you should make sure that you keep these things in mind. So the first one is that as a nurse, whenever you are providing care to the patient, you will be getting a clear understanding of how he reacts, of what are his habits, right? Of what are his various postures. So here, you should plan the movement of the patient ahead of time and you should also make sure that that particular path is clear. And whenever you are moving any object by the use of the truck, then you can flex the knees and the hip joints. But you must make sure that you keep the truck as vertical as possible. And whenever you have to move the patient from one place to the other, then with the help of a stretcher, you can do it. And before you move that particular patient from the bed to the stretcher, you should make sure that you keep the patient as close to the body as possible. You should avoid jerking and twisting while you are lifting any object or when you are lifting the patient. And if you have to move any heavy object, if it is possible, then it is preferable that you just slide or roll them rather than lifting them. And whenever you have to move any heavy patient, then you can also call for assistance. The height of the bed should also be adjusted before lifting or moving the patient. So here, as I have said, that if you have to move the patient from one place to the other, then you must make sure that you keep the patient as close to your body as possible. You can also ask for assistance if you are not able to do it alone. However, if it is possible or unless it is contraindicated, you should encourage the patient to use his abilities as much as possible to move from one place to the other in order to prevent lifting of the patient. And when he or she is moving by himself, then you should also observe the patient for symptoms of orthostatic hypotension such as fainting, dizziness, as well as sweating. So if these symptoms are present, then you should avoid telling the patient to move by himself. And when you need to move him from the bed to the stretcher or from the bed to the wheelchair, you should make sure that you lock the wheels of the bed, of the stretcher, and even of the wheelchair prior to transferring the patient in order to increase the maximum static friction between the wheels and the floor. So here, these are the various instructions that you must keep in mind whenever you lift or move any patient or any object. So I hope you have got a clear understanding of this topic. I'll be meeting you in another session whereby we will be continuing with this topic, where I will be teaching you about the various nurses' responsibilities in moving, transferring, or even lifting the patient or any other object. So until then, have a good day. Thank you.